Hello everyone and welcome to Inside Healthcare. It's the cold and flu season and we begin this program talking with the Minnesota infectious disease specialist about what you need to know to protect you and your family during this flu season. And we're very pleased to have back with us Dr. Peter Bornstein. Thank you. He's with the St. Paul Infectious Disease Associates.
Nice to join you again, Jody.
It's been a couple of years, I think, since you've been here.
A few
You've been
years.
very busy the last couple of years.
Yeah,
so.
Last year was the year of Ebola, so fortunately we're not dealing with that so much anymore this year.
And you know, the flu, it comes around every year and people maybe don't take it as serious, but it's a very serious problem in that people end up in the hospital. Some people even die from it.
Right, so the flu can vary from year to year, as you say. Some years are worse than others. But pretty reliably, every year, hundreds of thousands of people get sick, and thousands of people end up dying either from the flu directly or complications of having had the flu. So it's a very serious illness.
So who's at most risk, and why are they?
The people at highest risk are those over the age of 65, children under the age of 2, or pregnant women primarily. And then anybody who has a chronic health condition or an immune system disease, respiratory disease, these people also are significant risk of getting complications of the flu.
And just because they have a weaker immune system for the most part? Or?
For some of it, it's the weaker immune system. For others, what the flu does directly to the heart and lungs can cause further problems if they already have heart or lung disease. So for a couple different reasons, the flu can be a problem.
You know, and before we get into the flu vaccine itself, you know, I think a lot of people can confuse, like maybe they have some other kind of virus or something, but what exactly is influenza?
Sure. So you called it cold and flu season, and that's right, because we have both the flu coming around and also common colds. And the difference between the flu and the common cold is both that it's a different virus. The flu virus is a very specific virus called influenza. It's what we call a respiratory virus, so it attacks the lungs and the respiratory system. Cold viruses also can attack the lungs and respiratory system, but they're different viruses, and there's whole families of different viruses other than influenza that cause colds. Influenza is significant because it tends to be much more severe than common colds are.
And the symptoms, it comes on suddenly, usually?
Often comes on suddenly, often associated with very severe achiness, high fever, very sore throat. Certainly early on, it can be difficult to tell the difference between a cold and a flu. But for those people who've had the flu, they'll tell you, I could tell the difference between the flu and a cold.
So why should we be vaccinated against the flu?
Well, again, for most of the people who are at high risk, there's pretty clear indication to be immunized, that there is some protection. For those of us who may not have a health condition, we may want to protect those of us around us who do. So if you're a caregiver of someone who is in the high-risk group, if you're a hospital worker, HealthCare worker, these are all people who should get the vaccine, if not for themselves, at least for those around them for whom they're providing care.
I was thinking even like teachers maybe, or things like students.
If you're around children especially, or you're around ill people, or you work in an environment where there's lots of people coming and going. I'm thinking about the people who take the tickets at the movie theater. You know, if you're around lots of people during flu season, you would probably benefit from getting the flu vaccine. It would help you, and it would help the people around you. And
you were telling us before we got started that you've even started to see some cases already in the hospital.
We're finally starting to see some cases now. It's late October, and this is around the time when we typically do start to see some cases. Sometimes it's earlier, sometimes later, but right now we're starting to see cases showing up in different emergency departments around the area.
And typically in this part of the country, it peaks around right after the holidays, around the holidays, the end of December, 1st of January?
Right. For the strain called influenza A, yes, the typical peak is around the holidays, whether that's people coming together during the holidays or
hugs, kisses,
yeah, all those things.
Sharing things.
But typically influenza A, yes, your peak is late December, early January. And then influenza B, which is another different virus, but also part of the influenza vaccine, those tend to be later in the spring, March, typically February, March. So there are several strains of flu virus circulating during the season.
Now I know CDC had said that last year's flu vaccine, last season's flu vaccine, was not quite as effective. Some people got the vaccine but still got the flu. Some did.
Yes.
So what do we know about this year's flu vaccine?
Well, we don't have enough data yet because it's so early in the season as to how good what we call a match it's going to be. Typically, they do try and match them pretty well, and I haven't heard that there's any problems yet with the match. But you never quite know until the flu has become widespread if you have a good match or not and how effective the vaccine is going to be.
But even if you haven't gotten it, it's still not too late to go get your vaccine.
It's never too late. And people always ask me, what's the best time to get the flu shot? And because it can take 2 to 4 weeks for the immunity to kick in after you've been immunized, I tell people, well, if you know when you're going to be exposed, then you want to get the shot 2 to 4 weeks before that. But most of us don't know. So,
I have no idea, yeah.
It's really never too early to get the vaccine. And it's also never too late as long as it's still flu season. Because even if influenza A has already come and gone, there's still influenza B out there. So you want to get immunized when you can.
So what's the difference between the flu shot versus maybe the nasal spray? I mean, who should get one, and what's the difference between them?
Sure. So the flu shot is what we call a killed vaccine. And the killed vaccine means that there's pieces of the virus in there, but not the whole virus, and you can't actually get the flu from the shot. The nasal spray is a live virus vaccine, and that means that this is actually giving someone a dose of flu virus. It's what's called a cold adaptive flu virus, meaning it doesn't grow in warm parts of the body like your lungs, so it shouldn't cause any lung or respiratory disease. But nevertheless, it is a live virus vaccine, and there are groups of people for whom the flu mist or the flu nasal spray should not be administered. Typically, it's people over the age of 50 should not get the mist. Very young children should not get the mist. People who have immune system problems should not get the mist. So they'd be safer getting the shot.
So preferred probably to get the shot versus for most people, I would think.
For people who are at high risk, they're probably going to be getting the shot. Mm-hmm. For those people who are at low risk but want to get immunized and don't like needles, then the spray would be fine.
What about, we're hearing a lot about the high-dose vaccine.
Right.
What's that all about?
So a high-dose vaccine has 4 times the amount of immune-stimulating properties that a standard vaccine has. And it's primarily intended for older people who already have an immune system that naturally weakens as we get older. And so the high-dose vaccine is recommended for people over the age of 65. People younger than the age of 65 could probably get a significant enough immune response from the standard vaccine.
So with all of the different vaccines, what are the potential risks associated with them?
Well, the biggest risk, and the one I always get, is a sore arm from when the vaccine's given. I always figure, well, it must mean I have a good immune response because I'm getting a sore arm. If you're talking about the shot, that's really probably the main risk. It's just what we call a local reaction. Some people will get maybe some achiness for a day or two, but most people just get the local reaction, if any reaction at all. There is a special shot for people who have an ag allergy, which is sometimes significant for some people. Mm-hmm. But generally speaking, the shot is well tolerated. And that's one reason that the Centers for Disease Control recommend that anyone over the age of 6 months get a flu vaccine, because it is so safe and has such low risk compared to actually getting the flu.
And in past years, it seems like we've had shortages of the vaccine, but we're not seeing that this year.
We've heard that there's good supply this year.
Mm-hmm. So what other infectious diseases are common this time of the year that we should be aware of, and are there things that we can do to prevent them as well?
Sure. So not just preventing the flu, but other respiratory infections, rhinovirus and other viruses like that. The principal thing is good hand hygiene, so washing your hands, especially if you're in large groups of people before or after you're with them. We have the concept of cover your cough. So if you're going to cough, try and cough into your arm, not into your hands. Because if you cough in your hands and then you shake hands with someone, then you're potentially transmitting the virus. Those are probably the principal ways to prevent infection, whether it's the flu or any other viral infection.
Anything else that our viewers should know about protecting themselves and their families from this year's cold and flu season?
Well, the most important thing about the flu vaccine or any vaccine is that the more people who get immunized, the less chance we all have of getting the flu. And so it's especially important for not just for people who have the risk factors themselves, but for those around them who may be healthy but could potentially transmit the flu to them. It's important to get immunized. It's really the best defense we have against getting the flu.
Well, all great information as always, so thank you so much, and a pleasure having you back with us.
My pleasure.
We'll have to have you back again.
Okay.
Thank you. Thank you, Dr. Peter Bornstein.
You're welcome.